The other thing that was sort of questioned in publications prior to the whole study results being available, actually when this suggestion that the neoadjuvant study setting was the optimal setting to evaluate biosimilarity, there wasn't a single trial done yet, but we looked at the homogeneity of the patient populations because indeed that was one of the questions, was you had a heterogeneous population drop out for other reasons. But actually it turns out that both populations were very homogeneous. In most countries where you would study biosimilars, people don't have access to trastuzumab, which is the tragedy that we're trying to rectify with biosimilars. And so the prior exposure to trastuzumab was minuscule in the first-line metastatic trials. Patients were pretty homogeneous in terms of the amount of visceral disease, etc. And we're offering patients a much longer response duration, progression-free survival than they would have without the trastuzumab, which is great. So I think that we really felt that by looking in great detail at the way the studies were done and the results, that both the neoadjuvant and metastatic setting were equally good settings to evaluate biosimilarity, and that both could be used to extrapolate use of biosimilars in other settings, other combinations, and other diseases like gastric cancer.